This lesson we're going to talk about drugs and medicines. A good medicine is one that has few or no side effects, is effective against a specific illness or problem, is not addictive, and has no potential for abuse. Drugs are chemicals which cause a physiological or psychological change. When medicines are being developed, they have to be tested for toxicity, then tested on animals, then tested on humans. Then they get tested on a larger sample of humans before being given to the general population. In a single blind trial, the patient doesn't know if they're taking the placebo or a real medicine. In a double-blind trial, the patient and the administering doctor do not know if the patient is being given the placebo or the real drug. This helps to eliminate any bias. Some drugs are illegal because they have the potential to be addictive or harmful. Prescribed drugs are drugs that are given to patients by a doctor for an identified ailment. Non-prescribed drugs can be bought over the counter in a pharmacy or supermarket without having to go to a doctor. Performance-enhancing drugs are drugs which can improve the performance of a person in a specific area such as sports, for example steroids. Most people would say that these are unethical, as they can cause damage to the person who's taking them and give them a short-term unfair advantage over other athletes. Thalidomide was a drug that was developed during the 50s, that was tested on animals and humans, but not while they were pregnant. It was prescribed for a number of illnesses, and it was found to cause limb deformities in developing fetuses. While not being physically addictive, cannabis can cause psychological addiction. It can be a gateway to other drugs, and it has been linked to increased risk of mental illness.